Thanks to advances in cancer therapy, there is a rapidly growing number of cancer survivors. We as primary care physicians have a vital role in managing our patients' health after cancer. Many patients feel lost in the transition from oncology back to primary care. Many primary care doctors also find that continuing care after cancer is more challenging if not informed of recent treatment, prognosis, and follow-up care needs. A dedicated survivorship visit helps me focus on listening to the patient's cancer experience and understanding their treatment. This eases the transition of care for both the patient and me as their primary care physician. I encourage you to make health after cancer a priority. Communicate with your patient and other members of their care team. Take the lead in coordinating care with specialists. We work best together, with and for our patients, to learn, share care, and prioritize health after cancer. Just ask. Remember that patients may be hesitant to bring up sensitive topics such as mood, fertility, and sexual health, so invite them to tell you. Ask because you will continue to learn from your patients. Their stories may be the most compelling survivorship education. Your effort matters. More often than you realize, cancer survivorship knowledge helps us take better care of our patients. Your survivors truly appreciate it. Take an active role in reinforcing adherence, surveillance, managing treatment effects, and providing anticipatory guidance about late effects. Reassure and accompany patients as they face an uncertain future. You are an essential part of each patient's care team and path to finding health after cancer. We know there are barriers to incorporating survivorship care into practice. One of the most pressing is time management. Here are some strategies to organize a directed survivorship discussion. Use a template, like the one you've seen in this course, to navigate the visit. The template structures the visit and their survivorship conversation. A separate survivorship visit helps you and your patient focus on just these issues. Much like managing other chronic diseases, cancer survivorship warrants dedicated time. When searching evidence-based online resources, use directed terms like blank cancer survivorship to get disease-specific information. Utilize the resources we've provided for you and your patients. There may be additional local resources that an oncologist's office can recommend. We hope you have found the information in this course valuable and will adapt this knowledge in your own practice. Now that you've completed these materials, you should feel confident identifying key parts of a cancer history that may impact health for cancer survivors. Recognizing and describing long-term and late effects of cancer treatments. Using details of cancer diagnosis and treatment to make risk-based recommendations for comorbidity management and preventive care. Employing strategies for communication and collaboration with your patients and the whole care team. The future of survivorship is evolving quickly. Oncologists are very aware of the burden of late effects of treatment. There is now a concerted effort to minimize these toxicities through modified treatment protocols and novel therapies. For example, if Amelia were diagnosed with an intermediate-risk Hodgkin lymphoma today, she may not receive radiation at all. Bob's experience illustrates how some head and neck cancers can be treated without surgery. If surgery is needed, newer, minimally invasive techniques are far less disfiguring than historic procedures. Thank you for taking this course and step towards supporting cancer survivors. Engage with cancer survivorship in your own practice. You will have a meaningful impact on your survivors and their health after cancer. Thank you.